Pediatrics, it is one of those specialties where you can be wild and crazy and goofy and just have fun with your patients. But it's not all rainbows and sunshine. There are definitely downsides to peds. Today I'm going to be talking with a PA who works in general outpatient pediatrics, and she is going to give us the scoop on everything, what she really loves about it, the downsides, what the schedule's like, how many patients they see a day, which may be quite surprising to some, and what she says about the salary definitely surprised me. Hey there, it's Michelle with the Medicine Couch, and I love doing these interviews. I love hearing about what PAs and NPs are out there doing, all the unique specialties and jobs they have, and the non-clinical things they do. It's a lot of fun. If you like the channel and you love hearing this stuff, please subscribe and hit the like button on these videos. And of course, share the videos with friends and colleagues. Okay, now let's go see what is so exciting about working in pediatrics.
Michelle, it's such an honor to be on your show. Thank you so much for having me here. I love what you're doing and your platform. So I actually started out as a registered dietitian. I worked in adult medicine. And then towards the last 2 years of my career, I worked in outpatient pediatrics. And that is really where my passion for peds was formed. And I really just felt a desire to do more on the medical team. So I applied to PA school and graduated in 2017. And I've been a pediatric PA ever since graduation. But one thing that I love is that I get to combine my joy of nutrition and medicine in pediatrics. And I quickly realized that a lot of my colleagues didn't have that nutrition education that I was blessed to have as a dietitian. So I've also created in the last year and a half a podcast called Exam Room Nutrition, primarily helping clinicians tackle common questions that patients are asking them. And it covers the entire space of medicine. So it's from pediatrics all the way up to adult medicine. So I bring on registered dietitians and I ask them common questions that my patients have asked me or that questions that they're asking their provider or their PA.
Great. Okay. Well, I'll definitely put the links down below in the description box if people want to go check that out. So let's dive in and talk about pediatrics because you already said you love it. And so we're going to find out why. When we say peds, I think of a lot of little kids, but what actually is the age range that you see?
For my company, we see birth up to 21 years of age. So I've seen a baby as young as 2 days old that happened to be a home birth, and I have seen an adult all the way up to 21. And this is unique, however, because if you are a specialist in pediatrics, traditionally you end at 18. So we actually see a little bit of like adult medicine in my company. That transition, once they're 18, especially if they have any chronic medical conditions and they are seeing specialists, it's a really tough transition for them to now lose their primary care pediatrician and all of their specialists. So we allow that gradual transition into adult management and help them find specialists that would be a good fit for them.
So, what kinds of conditions do you see most often in pediatrics?
Most often for sick visits, I'm going to be seeing ear infections, pneumonia, a lot of viruses. So just your common cold. We see a lot of wheezing, whether it be from RSV or asthma, a lot of rashes from head to toe. So, in the babies, we get seborrheic dermatitis and the, drooling necks where they sometimes get yeast infections. We get diaper rashes, and then we're managing eczema as well. I do manage a lot of cardiac patients. So kiddos who are born with any kind of heart murmurs or anomalies. And then for checkups, I see a lot of checkups every day. And like I said, that's from birth to 21. So we're managing their developmental milestones and watching their growth.
I've heard that this is a specialty where you see quite a few patients a day. Can you give me an idea of what your patient count is on a regular basis?
You're absolutely right. The rumors are real. And it depends where you work. I'm in South Florida, so I'm actually in a very busy, populated area. I'm not in anything, rural. And I work for a big corporation. So my template or my schedule is set according to what they want me to see. And I actually have a unique schedule. I'm considered like a hybrid employee. So I work 2 regular days, so I would say 8 to 5, where I will see well checks that day. And then I will do 2 days a week, which is just sick care. And it's actually in our after hours. So that's between the hours of 5 and 10:30. And that's just sick visits. So on my days where I see just sick visits, the evening hours, I'm going to see 30 kids. But that can be, pink eye, a little eczema, they need a refill of their cream, but it could also be a wheezer whose, oxygen levels are in the 80s, so the acuity level can vary, but I'm traditionally seeing 30 kiddos in that 5-hour span.
Wow.
When I'm seeing kids during the day, during 8 to 5, it is a big mix of checkups and sick visits. And so my template essentially has about 20 checkups for the day and 17 sick visits. So if I have a full schedule, I'm seeing 37 kids that day between 8 and 5. Traditionally, however, I will see anywhere between like 30 and 35. That's like a pretty common patient load for me to see day to day.
People who work in medicine know that this is not our choice usually. It's usually what we're being told to see. But kids are unpredictable and not very cooperative at times. And yes, their visits may be shorter because they don't normally have a huge laundry list of different diagnoses and they're not on like tons of medication usually. So it can be more simple. But gosh, it just seems hard to corral and wrangle kids and get what you need to get done in that amount of time. Do you struggle with that?
You're so right. It can be really tough. And that is the easy part about pediatrics is like their medical history often is like nothing. They come to us kind of with no pre-existing conditions, no medication. So that does take some of that time away, which is helpful. Our company does a really nice job of managing how they schedule our appointments. And so we do have checkups and sick visits kind of alternating, and they know when we're really busy. So like the evening, between like 2 and 4, I'm really only seeing sick visits. So I'm not doing a new patient well check at like 4:30 at night. So they do a very good job at adjusting the schedule to make it feasible. We also have a really, really great electronic health record that's pretty much point and click. So I'm not spending any time after work documenting, which is really, really nice. But yes, there are times that my wait time might be 45 minutes to an hour. And that's because I did just have a kid that I was wrangling on the exam table trying to pull earwax from their ear. And it took me 35 minutes. So yeah, that is the good and bad with working in pediatrics.
Yeah. And so is there anything different about a typical clinic day than would be for working in adult outpatient?
I think the main difference is who our patients are, right? In pediatrics, oftentimes your patients aren't the ones telling you their symptoms, and kids are really bad historians. You're going to have to take what the child says with a little grain of salt because, again, yes, it's their body, and sometimes they're really good at knowing what's wrong, but oftentimes not.
Yeah.
And then with that, you also then have to educate and reassure the parent too. So I always say you're sometimes getting 2 in 1. And if mom, dad, and grandma are in the room, you're doing like 3 in 1 patients at the same time. And so that can be a little bit of a struggle. And that's a big difference with adult medicine.
And so what is your autonomy like, or any problems with parents not wanting to see a PA?
Honestly, it's the opposite. I have a lot of the patients that will see me sometimes in that sick clinic I was telling you about in the evening times. And they ask like, oh my gosh, can you be our doctor? And I use that term loosely, because they just kind of call anyone in a white coat doctor, but can you be our provider, And so they actually want to see me over some of the MDs and DOs in our practice. And I think that's fantastic because they do have that choice. You can choose who your provider is. And if you click and connect with someone, whether it's an NP, PA, or a doctor. And so I have complete autonomy. Actually, in the evening hours, I'm working alone. There's no other provider with me. My patients are my patients. They're on my schedule. The doctor does not come in after me and approve everything. Sometimes they pull me in the room and ask for my opinion on something or help removing a foreign body from the kid's ear or something about the child's growth chart because they know that's my bread and butter. And vice versa. I might have never seen a certain rash before and they come in and help me. And it's a really great working relationship. And I think that's how PAs and MDs should be working all along.
You mentioned removing foreign bodies. It made me think, what kind of procedures do you do in peds, or do you do any really?
Okay, so foreign bodies in the ear are probably the most common. It's actually one of my favorite things to do because the child gets instant relief. The parent's reaction is like over the top because they cannot believe what was in the kid's ear. I've pulled out a crayon tip, eraser tips, pencil lead, multiple insects, so cockroaches and beetles and flies. Actually, my favorite thing that I pulled out, a tooth. The child had
Oh,
plucked their tooth and put their tooth in their ear. I have just endless
why?
stories of things that I pull out of kids' ears. So it's fun. I really enjoy that. Other procedures, obviously foreign bodies in the nose. I will do urine caths for any infant who, I'm concerned about a UTI. I also will do INDs in the office for any abscesses and drainage. And then we don't suture because, as you can imagine, with 37 patients on my schedule, I don't have the time to do that, but I will dermabond simple lacerations, on the chin or the eyebrow. And that's something that we do in the office.
And that's part of the unpredictability about peds, I guess, is because you never know what kids are going to do. So is that one of the things you enjoy about peds, or is that just get annoying and frustrating after a while?
Okay, I actually love it because, as you can tell, I'm just smiling and grinning ear to ear. I love working with kids because, like what you said, they're unpredictable. They're honestly hilarious. Half the time when I pull something out of their ear, right? I have it in my hand. We're all looking at this thing that came out of your ear, and I say, "Oh, sweetie, how did this get in there?" Right? Like kind of a rhetorical question, but
Right.
I'd like to know. And they look with a straight face. I don't know. I didn't put it in there. And we all know we're adults. It's like, yes, yes, you did. It didn't just, your tooth didn't just magically go into your ear. So I actually really enjoyed that aspect about working in pediatrics. It's a really fun part of my job.
So what are the other things about peds that you like or that you think other people might like about it?
I actually have four things, and I had to narrow it down to four things because there are just so many things that I love about working in pediatrics. The first one is it's fun and it works great for my personality. I have, as you can tell, a little bit of a hyper, louder, high energy personality. That works great with kids. They really connect with that. So it's just so much fun. I also love that I get to be part of their major life events, right? Like 21 years of a child's life is a very long time to be with them and watch them. This is, the time that they're becoming infants and are completely dependent on the adults in the room to adults themselves and possibly even parents. So I just think that's such a cool role to have in someone's life and watch them go through and struggle through the journey of life and watch all these life transitions. So that's just such a joy to have that place in someone's life. Third one is, I love nutrition, and it's a really important topic to talk about with kids and with their parents. And, the first year, parents have so many questions about how to feed their child. What formula do I use? The kid's really picky, and so many questions. And growth is really important. And I'm looking at growth charts multiple times a day. And so I really love the fact that I still get to blend my nutrition knowledge and education with medicine. Lastly, and this one just touches my heart so much. And this is because I get to set the foundation for their relationship with the provider for the rest of their life. And I don't take that role lightly. There's no other career in medicine where you get to have that role of setting that foundation for that relationship, right? I mean, if that 2-year-old, that 10-year-old, that 5-year-old has fun with me, they feel that I respect them, that I listen to them, and they're excited to come to the doctor's office and talk about their life and their day and their symptoms, and they're not scared. They don't feel like they're going to be judged. I promise you that person who will become an adult will have a great relationship with their adult provider when it really, really matters.
So what are some of the challenges that you have found in pediatrics or that people may not realize happens or that you have to deal with in peds?
Oh, yeah, it's definitely not all sunshine and roses. So, yes, I really love my job, and there's probably for me way more good than bad. But you're totally right. There are some patients that when I see them on my schedule, I'm like, oh no, either like you experience, like it's an older child, and I usually don't see that hypochondriac kind of like nervous about every single symptom arise until preteen and especially teen and later, late teen, early adulthood. And it's because they're little adults, right? And personally, this is why I don't ever want to work in adult medicine is I think adults exaggerate and sometimes they lie just to get a prescription. Little kids don't do that. They're not quite manipulative yet to their provider. They may manipulate their parents when it comes to eating, but to their provider, they tell it like it is. Does your throat hurt today? yes or no. And they'll often say, no, I feel fine. Whereas the parent is like, oh my gosh, their throat hurts so bad. And you ask the child, and they're like, no, I feel fine today. So there's a little bit of that where you do have to tease out what exactly is going on and who's telling me the truth. But I think a lot of the common challenges that we face with pediatrics specifically is that you are taking the history from the parent. And again, sometimes they can exaggerate things, sometimes even make up things. And again, kids are not great at telling you their symptoms all the time, especially when it comes to things that are not like pain related. So if it's, my ear hurts, they're really great at that. Almost all the time, they're spot on when it's an ear infection. But if they, tell the parent that they have a headache, I find that a 5-year-old doesn't describe a headache very well. Same with tummy aches. They can't really differentiate like gas pain, well, or I ate something, it's just not sitting right, or I feel nauseous. You have a really hard time quantifying pain. So that is a big challenge, and you do have to rely on the parent a lot for that.
Yeah.
I think another one that will lead to a lot of burnout for providers is the hand holding that's required for the parent. A lot of the time, they're new, they're very anxious with everything about their infant, especially, but this goes on for years, that you do have to be very patient, provide a lot of reassurance and education, and I call it hand holding, as you're walking them through, like, no, 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 that bump on their pinky is normal. It's okay that, they're not crawling yet. She's only 4 months old. So I think a lot of reassurance, and it can get old and it can get a little bit exhausting because our voice is competing with the voices on the internet and the quote experts or like mompreneurs on TikTok who are creating unrealistic expectations or just spreading misinformation. Then we have to be that voice of like, no, this is actually what the science says. This is what your baby should be doing at this point. And that can get really, really tiring when you're doing that 37 times every single day.
Yeah.
So that's a big one that I think leads to burnout a lot. And the other thing too is that, a child's condition can change rapidly, for better or for worse, right? They crash quickly, but they can rise really quickly as well. And what I find that's very frustrating is people's standard for, use an ear infection for an example. I might see an ear and think it looks fine. It just might be a little red. It might be a little fluid, but I don't quantify that needing and warranted antibiotics. But maybe they see someone the next day and they think it looks like an ear infection and they get antibiotics. And then I look like I missed something or that I'm incompetent. So I think with pediatrics, there's so many opportunities for them to see other providers besides just their primary care. And you can get different standards and different type of care from a variety of places. So that can get really frustrating. If they turn around and look at you and like,
Right.
you missed my kid's ear infection. And it's like, I didn't, but their condition can change pretty quickly. And
Yeah.
that's hard to explain to parents.
What about like things, I don't know if you see this much in outpatient, but things that are hard in peds because unfortunately kids get, devastating diagnoses too. Do you deal with that much in outpatient peds?
I do. I have diagnosed a few kids with type 1 diabetes, and that's very scary for the parent. And I'm on the front line of that diagnosis. And so I will kind of prepare them for what I know is coming. When they send them off to the ER for admittance, I'll have to explain like, this is what I think it is, but we need to do a little bit more tests. And, you're going to go to the emergency room and they might tell you this. So again, it's a lot of reassurance. It's a lot of support and just coming alongside the parent and like just being that pillar for them. That's what I think a really important role of the pediatrician is to just be that pillar of hope, that pillar of truth, and that pillar of just calm. And like, I'm here, we're going to walk through it and I've got you. I'm with you in this. A couple other things that I deal with a lot in pediatrics outpatient is more of the mental health that children are going through. I work in an area there are a lot of children who are in the welfare system. So they're in and out of foster homes or in and out of even group homes, which to me is devastating. And a lot of them are unbelievably numb to this lifestyle that they just are like, oh, yeah, I got to go to my house. I'm going to get my trash bag of stuff because I'm going to, a new house tomorrow. They just kind of so flippantly say it because unfortunately it's their reality and they're just so used to it. And so that is so sad and heartbreaking to me. We deal with a lot of abuse cases because that's why a lot of them are pulled from the home due to sexual abuse. And so that weighs very heavy on me. And that's another reason why I respect the role that I'm in, because if but for 5 minutes in this enclosed doctor's office exam room, I can create a joyful, peaceful, acceptable space for that child, I think my, impact will be profound on that person's life, because I don't know what they're going home to. I don't know what they just left, but in this room with me, it's going to be fun and you're going to feel loved. And I think that is an important mindset for a lot of pediatric providers to have, that we don't really know what's going on with them at school and their home life. And I think if we can just create that space for them, will be so impactful for their lives. The other thing that I deal with a lot in that mental space aspect is how a previous provider talked about that patient's weight. And a specific 9-year-old comes to mind. He saw me for a sick visit. I think the chief complaint was like a rash. And I walked in and he's crying, which is not unusual in the pediatric space, but he wasn't getting a checkup. Like, there were no shots. So I'm wondering, and I say, "Hey, honey, why are you crying? What's wrong?" And the mom had said, well, the previous clinician told him that he needs to lose weight by the next time that he's here. And he stepped on the scale today and he put on 3 pounds. And he's really upset with himself because he has been weighing himself and he's been dieting and he's, hasn't been eating at home. And he's just really concerned that he didn't lose weight and he feels really bad about that. That moment, my heart sank, because a 9-year-old does not need to be concerned with his weight when in fact his weight was actually normal. He was not a morbidly obese child. He was just a normal prepubescent young boy who grows a little husky first before they hit that puberty growth spurt, and they lean out. And there was no concerns at all, and he was doing just fine. And so the words that that provider used, which probably was unintentional at his previous, 6 month ago checkup, they probably meant no harm, caused significant mental damage and emotional stress to that child that, I have been working with him and building him up, and he's now with the counselor to kind of undo that. And so that's a lot of my role, blending again that nutrition counseling with medicine, is sort of encouraging them about their body image and about how the foods that they eat are nourishing, and really not focusing so much on their weight.
Kids are very impressionable, right? And so you have to be extra careful, I guess, in how you present things. When you talk about abuse and things like that, how often have you had to call Child Protective Services or do the mandating reporting? Is that something that people need to be thinking about if they're looking at going into peds?
Absolutely. I would highly recommend getting a little bit of education on like what to look for, some signs to look for, what your local health department and DCF department is, or Child Protective Services would be, because I would say probably maybe a few times a quarter. So less than 10 times a year, but I'm still dealing with it. I am making a case. I am getting on the phone with a police officer. Often it is a parent that's intoxicated in the office. So if it's a really strong smell of marijuana, or they just don't look like that child is safe to drive home with them, I will call for that. I have called for sexual abuse that the child had let me know about. I have had to call about a very young child pregnancy that she was actually like raped by an adult and didn't tell anyone. So we do see those cases, and those calls have to be made. It's heartbreaking. That's a really hard part about working in pediatrics.
In movies and TVs, you always see the stereotypical nervous young mom usually calling the pediatrician at 1 in the morning because their child is coughing or whatever. How do you guys handle call? Do you take call at all? Do you rotate it through different providers in the office? Is it as bad as it is portrayed?
It will depend on what company you work for. So I think the smaller companies will take call, and they usually do rotate. I worked for a different company about 6 months right after graduation, and we took call and we would just rotate it. I don't like it because, yes, you are getting those like, I need diaper rash cream, and it's like 1 a.m. and they're calling for that. Um, so unnecessary bothers in the middle of the night. Currently, my company, we are open 24/7. So we actually have telemedicine that are providers who want to do telemedicine, and they are available 24/7 via video chat. We also have like a nurse's hotline, so they can call and at any time be answered by an RN that's hired through the company. and they'll triage that. So if they think like, oh, it's an emergency room visit, they'll send them on. Or if they do need to speak to a provider, they'll put them on through the telemedicine. So I don't have to deal with any of that. Once I step foot out of my office, I leave it there. I don't deal with it at all at home.
Yeah.
And as for hospital rounds, PAs, NPs, we don't do hospital rounds in my corporation. Again, some companies do, which I'm kind of glad about. It's just really, really early mornings and it makes the day that much longer. So that is not part of the role that I do, but that is something to know if you do work in pediatrics, you may have to go to the hospital and you will see, new babies who are going to be joining your practice.
Oh, yeah, I didn't realize that that was a thing. Can you talk about that a little bit more? Explain it better.
Yeah. So if I were to go to the hospital because I'm having a baby, they will ask you who is your primary care provider because when you're discharged, they're going to help you set up those appointments. So they will basically, reach out to you like a referral consult. You will get notified that you have a new baby to see in the hospital. You're usually just establishing contacts, but you're also working closely with the internist in the hospital, but you're often the one to decide like to discharge the baby, that they're okay and safe to go home. Sometimes like our corporation will have hospitalists specifically for our group that only sees the babies in the hospital to establish care and discharge and then set you up with our outpatient office.
Okay. So when you were talking about Peds outpatient, that you guys actually have opportunities for people to do telemedicine and even shifts like through the night. Do you think that's pretty common?
For the bigger companies, I would say yes. I know some of my colleagues who do like a few days in the office and a few days on telemedicine. And like I'm a hybrid, I do a few days 8 to 5 and do checkups and sick visits and a few days as the sick visits. And that I like the times because I go into work at 5 p.m., so I have like the whole day off and it's nice.
Yeah.
We're also open holidays. So if you're going to be working in pediatrics, expect to work holidays and weekends because kids get sick all the time. It doesn't matter if it's Christmas, Ramadan, Hanukkah. They're going to have a fever and parents want to bring them in.
I've heard Peds doesn't pay that great. So what has been your experience?
If it is a smaller individually owned practice, you're probably going to get paid pretty low. I would say like 75 to 95,000 a year. And that's what I have seen. Again, this is definitely going to depend where you live, like what state you're practicing in, because this varies widely. But if it's a larger corporation, like the one I work for the largest corporation in the nation. So they do have a lot of money on the business end of things. They also have a lot of opportunity. So like I was saying, you can kind of pick and choose your schedule, which is really nice, which is why I chose to do that 2 and 2, where it's 2 regular days, 8 to 5, and the 2 after hours or the sick visits, because you do get paid more to work those undesirable shifts. I also do work weekends. So I work 2 weekends a month. So I should mention that. So when I work the weekend, I am working 6 days a week, but it's not 6, 10-hour days.
Right.
It's 6 days, usually like between 8 and 5 hours a day. So all that to say, with a bigger corporation, you can sort of mix and match how you want to work, and that might bump up your salary a little bit. So in my organization, if you are a new grad and you want to work your traditional Monday through Friday, 8 to 5, you're looking at anywhere between like 95 to 105 as a starting salary. For someone like myself who does undesirable hours with like weekends and nights, you could be between 115 and 140. So I'm on the upper end of that. I've also been with the company for 8 years.
I would not have guessed that you could have that range. So not bad at all to know that those options are out there. So if somebody's interested, say maybe they work family practice or just in another specialty and they suddenly realize I really want to work in pediatric outpatient, what are some of the ways that you would suggest they prepare themselves to become a good candidate?
Number one, and I feel like this should go without saying, but it's important. You have to like kids. I have seen and heard of some pediatric providers that are like grumpy and impatient, and I question why they became pediatric providers. So a great way to know if you like kids, if you're not a mom yourself, like be around kids and try to have a conversation with another adult with kids crying, screaming, goofing off right next to you. If you can do that, you'll be just fine in pediatrics. I think, just practice being around kids too. You kind of have to have like different conversations with them. I walk in the room, I'm looking at them, trying to find something that I can connect with them. Do they have light up shoes? Do they have a cute bow in their hair? Do they, look kind of athletic? And can I say like, oh, I bet you run really fast, right? Something to connect immediately before I even sit down and introduce myself. That is a skill that comes with practice that makes it just so much more pleasurable and fun to work in an environment where the child is excited to see you just as much as you're excited to see them.
Are there any references that you use regularly?
billytool.org. That is a online calculator to risk stratify kiddos with elevated bilirubin and to determine if you need to send them to the hospital for phototherapy. Bright Futures has a pocket guide that's put on by the Academy of Pediatrics. It's really, really helpful for like developmental milestones and things you should be checking at each checkup. The PD Quick Calculator app is very helpful because in pediatrics, which is very different from adult medicine, everything is weight-based dosing. And so there is math that's involved. Of course, I have to give a plug for my podcast. If you want to learn more about infant feeding, formula, and picky eating, we discuss that often.
If people are in school or going to be doing rotations, they may not get a great peds rotation. Are there any other rotations that you would advise them to try to get that may help them?
4 rotations come to mind. The first would be ENT. Again, because you're going to see ear infections and strep throat and tonsillar abscesses all the time. So if you can get with an ENT, very helpful. Second would be pulmonology, because again, we're dealing with pneumonia and asthma a lot. And so learning those treatments would be really helpful. Third would be cardiology. We see a lot of heart murmurs, kids with elevated blood pressure, or just kids with palpitations, sports physicals, right? You want to rule out all of those, congenital anomalies. And then lastly would be dermatology. How to treat eczema, what do you do with warts? How do you treat acne, right? These are really common things I see multiple times a day, that getting that information and education from the specialist that's their bread and butter would really prove beneficial for you when you're in general pediatrics.
And then what about this specialty, someone going into it as a new grad?
I knew I wanted to be in kids, so I went straight to pediatrics. Some companies have really great training for new grads. My company does, which I think is really helpful. They don't just throw you to the wolves. You're not seeing 37 patients your first day. They have a mentorship program that walks you through a lot of things, which I think is really, really helpful. But it is tough because it's primary care. So you are seeing all of the medical conditions, and you really have to make quick decisions and know when to refer, know when you're comfortable treating things. And so it can feel like a while before you actually feel competent and confident in your skills. Don't be afraid to ask questions too when you're just getting started. That's the best way to learn.
Any other thoughts, Colleen, that you have about pediatrics or why you think people should consider going into this specialty?
If you are a goofy, like Michelle and my daughter call me, but I like to say bubbly, silly, compassionate, and patient provider, go for peds. You will love it. I have endless stories about things kids said, and I get to wear light up shoes. I wear really big, loud earrings. I wear Minnie Mouse t-shirts all day, so it's just such a fun environment. And I would say if that sounds like you, do it. You will absolutely love it.
If you like peds, but maybe you're looking for a specialty, then check out these videos here. And don't forget, you can always check the playlist on my main channel page to find the videos that you're interested in. Thanks for watching, and as always, take care, stay sane, and I'll see you next time on the Medicine Couch. Bye.